Welcome to Pharmacology Lectures. We were continuing now tropicamide and cyclopentolate. These are used topically for ophthalmic solutions for mydriasis and cycloplegia. Duration of action is shorter than atropine. Tropicamide produces for 6 hours and cyclopentolate for 24 hours. Now benztropine and trihexyphenidyl. These are used with as an adjunct therapy for the treatment of anti-Parkinson disease. Now, oxybutynin and other antimuscarinic agents for overactive bladder. Actions: what does it do? How does it do? In the bladder, the receptor is M3. Now, intravesical pressure is lowered and bladder capacity is increased. The frequency of the bladder contraction is thereby reduced. So what will be the actions at M3 receptors? Salivary gland, CNS, eye, all of these have M3 receptors, so the adverse effects will appear here. Now dariphenacin and solifenacin are relatively more selective. They are more selective antagonists. However, other drugs are non-selective. They will act on M1, M2 and M3. Now the therapeutic used for overactive or urinary incontinency. Oxybutynin is also used in patients with neurogenic bladder. Pharmacokinetics available in oral dosage form, long half-life, only OD, as it has long half-life, so it is used only once daily. Now oxybutynin is also used as a transdermal patch and topical gel formulation. And all of these are hepatically metabolized by cytochrome P450, so these drugs will be affected by inducer or inhibitors. Adverse effects will dry mouth, constipation, blurred vision. Now you can see these are the adverse effects: blurred vision with antimuscarinic antagonist, blurred vision, confusion, mydriasis, constipation and urinary retention. Now here we have summary for muscarinic blockers. We'll have some here. Now the drug first we studied trihexyphenidyl and benztropine. These are used as an adjunct for Parkinson disease and management of extrapyramidal effects. Now dariphenacin, fesoterodone, oxybutynin, solifenacin, tolterodine, trospium, they are all used in urinary bladder incontinency or overactive. Cyclopentolate, tropicamide and atropine, they all are used in ophthalmology to produce mydriasis. Atropine is most important drug to study. Atropine to treat spasm in GI tract, to treat organophosphate poisoning as an antidote, to suppress respiratory secretions prior to surgery, and to treat bradycardia. Scopolamine, motion sickness, you have to remember this. Aclidinium, glycopyrrolate, ipratropium and tiotropium, these are all for COPD. Now ganglionic blocker, nicotinic, this is used for smoking cessation. Now ganglionic blockers specifically act on nicotinic receptors. Okay. Now nicotine. For ganglionic blockers we will study nicotine. This is especially used for smoking cessation. Nicotine is a poison with many undesirable actions. Without therapeutic benefit, it's not beneficial to use it. Now depending on the dose, nicotine depolarizes ganglia, first resulting in stimulation and then paralysis. These effects are complex and result with increased release of neurotransmitter. Now you can see here nicotine, what does it do to all the neurotransmitters. Nicotine, by suppressing dopamine, effects of nicotine. Okay. Now by dopamine it will give pleasure, appetite suppression. Norepinephrine, appetite suppression, arousal and cognitive enhancement, memory enhancement, mood modulation, appetite suppressor, reduction of anxiety and tension at GABA receptor.